Okay, welcome everybody to our February Lunch and Learn session. I've just started our recording, so as folks are coming in to join us, I wanted to welcome everybody here. Today we're going to be talking about kinship caregivers and the New York State Office for the Aging. We've got Deana Prest joining us today from NYSOFA, and we have our sponsor, Ann Curcarito from the Times Union. I'm going to turn it over to Ann to offer a few brief words. I first just want to mention that today's webinar will be recorded. It will be available after our session today. Everybody is on mute. If you have questions during the presentation, please feel free to drop them in the chat. We will answer them at the end of the session. And as I said, this webinar and all slides will be available after today's presentation. Okay, turning it over to you, Ann.
Thank you. Good afternoon, everybody. I just wanted to say that the Times Union is proud to be a sponsor of the New York State Kinship Navigator Lunch and Learn webinars. I'm the Director of Community Engagement. I work with a lot of nonprofits, part of the Women at Work networking group that we have, and I collaborate quite a bit with other leaders that interact with vulnerable populations that we serve, and work with some of the different entities as well to kind of uncover where the greatest needs are in the community. And I'm a big believer in this program and the webinars that the New York State Kinship Navigator has to offer, and I feel it's very important for everyone. So thank you very much.
Thank you. We appreciate your support, really do. So I'm going to be brief today. I'm going to talk a little bit about our Lunch and Learn series and then just a little bit about what the Kinship Navigator does. As you see, our Lunch and Learn series, they're sponsored by the KinCare Coalition, the Kinship Navigator, and right now the Times Union. They're 30-minute presentations where we discuss different service providers and supports for kinship caregivers. There's a link to all of our videos here. Next month's Lunch and Learn is again the third Thursday of the month, which I believe is the same in March 17th. And we will be working with Prevent Child Abuse New York. So stay tuned for that. Next week, we'll have information coming out. I'm Rae Glaser. I'm the director of the New York State Kinship Navigator program. And the Kinship Navigator program is information, referral, and education for kinship caregivers, professionals, prospective caregivers all across New York State. We've got a helpline Monday through Friday, 10 to 4. We have a website where you can access different resources, legal fact sheets, videos, and information about our services that we provide to caregivers. We are, as I said, information and referral. We provide legal fact sheets. We provide statewide and county-specific referrals. We work the local kinship programs, permanency resource centers, legal referrals for kinship caregivers. We also engage with professionals across the state. We provide presentations on Kinship 101, kinship financial options, KinGap, kinship legal options, anything that your agency might be interested in. We're able to do that via Zoom, via Teams, or in person if you prefer. We also provide advocacy for kinship caregivers on a case-by-case basis. And we run the New York State KinCare Coalition. My associate director, Ryan Johnson, is the chair of the KinCare Coalition. If you're interested in kinship policy, legislative work, we encourage you to join our coalition. We just had our education day this past Tuesday. You can visit the kincarecoalition.org or email me or Ryan directly in order to join. Here's just a brief snapshot of our website. On our website, we've got information for caregivers, legal fact sheets. We have a Find Your Resource feature where you're able to look by county and resource to see what's available in your area. We have online education. We've got videos on Kinship 101, financial assistance, how to fill out an application, KinGap, basically anything that you could be looking for. And if you'd like to reach our Kinship Navigators during business hours, you can take a look at the bottom right hand of your screen. There's an online chat where you can reach them to ask all of your kinship questions. One of our other major features of the Kinship Navigator program is virtual case management. We now offer virtual case management in 14 counties, soon to be 20 as of next month, where we assign a Kinship Navigator to a kinship caregiver's case. They will stay on the case for up to 6 months, assist with benefits applications, provide facilitated referrals tailored to the caregiver's needs, There's extensive follow-up from our kinship program. We work with that person one-on-one to establish, identify, and meet all of the client and children's needs and their services. You can see on the screen which counties have those services available. You don't need to do anything special. If you're a kinship caregiver in one of those counties or a professional working with a kinship caregiver, feel free to give them our phone number and we will offer them those services. One more feature of our program important to note is our permission to contact form. If you're a professional working with kinship caregivers, feel free to fill that form out with a caregiver, fax it to us, and we will be in contact with that caregiver within 48 hours. Just another way for us to reach out to a caregiver that might be a little bit overwhelmed with everything on their plate. We have on our homepage that permission to contact form, and if you'd like information in the form of brochures, trifolds, flyers, to send out about our program, we're more than happy to send those to you. Just feel free to get in contact with us. At this point in time, I'm going to turn it over to Deana Prest, the Caregiver Support Program Director from the New York State Office of the Aging, to talk a little bit about how kinship caregivers and NYSOFA can work together. Over to you, Deana.
Wonderful. Thank you so much, Rae. It's a pleasure to be here with all of you, and I appreciate you taking your lunchtime to spend with me. So you can go to the next slide, Rae. This is just a little bit of an agenda just to kind of give you an overview of what we're going to talk about today. Next slide. So we always kick things off with just kind of making sure that you understand the mission of the New York State Office for the Aging, because I don't know how familiar you are with the agency, but I'm not going to read this word for word to you. But essentially, our aim is to really help older New Yorkers remain independently as possible for as long as possible. And of course, that takes support of those family members that are also involved. Okay, next slide. So again, even though we're going to be focusing today more on the respite and caregiver support component, I just think, to have an understanding of what the New York State Office for Aging does and what the network does as a whole is just important to kind of highlight. So here's just a list of all of the services that, basically happen at the local level, but are supported through our state agency. So I want to kick things off with New York Connects, and the reason that I'm doing this is it's because it is our no wrong door system in New York State, and I don't know how familiar you are with them, but you'll see later in the presentation why I thought it was important to kind of kick things off here. So the no wrong door systems, they provide information and assistance not only to the individuals that are needing help publicly or private through public or private resources, but also for professionals that are actually working with individuals, and that includes caregivers. So I know some of you on the call today may be a professional, and so I just thought it was really important to highlight what New York Connects is all about. The no wrong door systems oftentimes the entry point. So, here in New York, that program is New York Connects. And essentially, any long-term supports and services, whether they're funded through Medicaid, the Older Americans Act, which is primarily what I oversee, or through the Veterans Health Administration or other state-funded programs, essentially, New York Connects can help in getting people access to services. Okay, next slide. And these are just kind of the reasons why it's the trusted place to go to for free and unbiased information. It serves all ages, all types of disabilities, and that could be medical or non-medical, basically to make sure that the person has what they need in order to either improve or maintain their health and their independence. It could be in the community. It could also be that, someone seeking information about nursing home. So the goal, though, is to streamline the access, reduce the fragmentation, and then support independent living for as long as possible. So this program, New York Connects, it does operate at the county level in each borough of New York City and 2 Indian reservations. So each New York Connects is a collaboration consisting of the area agencies on aging and potentially some of their subcontractors, the local Department of Social Services, and the independent living centers across the state. And as a result of the balancing incentive program, we actually expanded both geographically and with enhanced functionality to really become a more fully functional no wrong door system. So these other additional state and local partners that you see listed here helped us with that expansion. Okay, you can go to the next slide. And this is just a listing of what the New York Connects program must do. They have some core functions, which include that they screen, that they provide information and assistance, and they also are trained options counselors or person-centered counselors. I apologize. I almost said too, my dog may bark because I'm home today, so I'm so sorry. Whenever we get the mailman or UPS in the driveway, he doesn't like that very much.
It adds an element of reality.
I know.
Don't even worry about that.
And I'm in the office Monday through Wednesday, but Thursday and Friday, that's always a challenge.
You got it.
So my apologies. So essentially, these are the core services. But the follow-up, I would say, really strengthened when the BIP was implemented as part of New York Connects, because now we really make sure that there's that warm handoff, that the person that's being referred for services got connected and was happy with the outcome. Okay, next slide. So additionally, the local New York Connects offices are responsible for application assistance, enrollment into public benefits, care transitions. If there's, someone who's looking to go back into the community from a long-term care setting. They also have a responsibility to facilitate an active long-term care council. And that's essential with getting all the right people around the table to collaborate and make sure that it's strengthening, what they're trying to do for that person that's in need of care. Okay, next slide. So this is how folks can get in touch with New York Connects. It's either, I think you can go to the next slide, Ray. I think I have them all broken out. There's an 800 number. So by calling the 800 number, you can, then put in your zip code, and that'll get you to the local INA representative. The next slide is the website that you can go to, and that's really at the local level, there's a responsibility for all the resources in there to be kept up to date. So you could actually do, a local search. My goodness. And, try to figure out there, if you know exactly what you want, which I think I have a screenshot in there just to kind of demonstrate for you too. So you can go to the next slide. There you go. So there's your options. If you know what you need, you can choose that over to the left-hand side. If you need help with what you need, and you want it to be more structured where you have a guided search, you can do the middle option. And then all the way to the right, you can kind of explore based on a category of interest. Okay, so now let's get into talking more specifically about what we do to support our family caregivers, including kinship caregivers. I can go to the next slide. So we actually offer kind of a lot of different programs and services, but I will say that the approach with any of these is that we try to look at it as providing the right care at the right time and in the right place. So in order to accomplish this, those caregivers that are involved really need to be supported in a variety of ways with a person-centered approach. So the three program areas that you can see here, I listed all 5 because I wanted everyone to be aware that we have a couple other programs that are more focused on supporting caregivers of older adults. But the 3 that are highlighted really are what's applicable when you're thinking about kinship caregivers. So we'll dive into the first one. So the National Family Caregiver Support Program, there is eligibility. And I always like to point this out because we don't actually refer to the eligibility for our kinship caregivers with that terminology. We actually, under this program, which is a federal program, it's older relative caregivers. So you can see there that these are caregivers, and there is the age eligibility of them needing to be 55 or older that are caring for a child under age 18. And they can, obviously not be the parent, the biological parent. But in addition to that, what falls under this bucket of older relative caregivers is caregivers who are supporting an adult age 18 to 59 with a disability, and that can be a parent. We see a lot of times that, parents don't always want to have services started through OPWDD for their child, but then as they're aging and the child becomes an adult and the care needs might be too great, that there is a component here to help with that as well. Okay, next slide. So the services under the National Family Caregiver Support Program, they include information to caregivers. A big thing that we push is, where do you find the caregivers that aren't already connected? So we do require that our network is out there spreading the word. And when I think about for kinship caregivers, often we give the recommendation that you're seeking places such as the public school systems, right? Which guidance counselors often know, like, where this, family structure, where, which families are impacted by this and who could utilize the service or be a good referral source when or if the time comes that they do need help. But essentially, that happens in a variety of ways. You'll see that they sometimes will put ads on placemats in the diner or in their local newspaper, or they might do a informational session at a public library. So a lot of different things. Of course, right now they're getting very creative with things kind of pivoting to virtual platform with trying to get the word out, but there is a responsibility for that. And then, of course, assisting the caregivers in gaining access to services. And that's not just services that they offer through the program. So that's any service that could be available in the community that they are required to provide that INA. Then the next 3 bullets you'll see are the actual services that we offer. So through our 59 area agencies on aging, so every single county does have this program except for one. Seneca County does not currently have the program. The services that you would see being offered are caregiver counseling, support groups, or training. I know there's a lot of great programs that are kind of specifically looking at kinship caregivers, such as the PASTA program. You may have heard of that. We have a few counties that offer that. Respite care, which I think we're going to get to this in a few moments, but really there's a huge need there. There's not a lot of options for respite care for kinship caregivers. And I would say that's probably the service of the most cost. And then supplemental services, which I love that we have this available under this program because it allows for that flexibility and that person-centered approach where really meeting the caregivers where they need. Like some examples include, I know down in New York City through the Grandparent Resource Center, they are able to help grandparents with, maybe some financial assistance for back to school supplies or back to school clothes. We heard a story, which I thought was a wonderful story from another state where a grandson wanted to go to prom and they really just couldn't afford for his tux rental. So the program was able to, cover the cost of the tux rental so that he could go to prom, which I thought was awesome. Okay, next slide. So the other program that we administer out of the Office for Aging is Lifespan Respite. And this is through, these are state grants, competitive process that are really designed to help us kind of build a sustainable lifespan respite care system. The great thing about Lifespan Respite is that there is not the age eligibility. So this is meant to serve caregivers across the lifespan, which gives a lot of flexibility with the funding. We, as the lead agency, NYSOFA is the lead agency, we are required by law to work with at least one aging and disability resource center, which we just covered New York Connects, and that was part of why I wanted to cover it. So that's our partner here in New York. And we are also required to enter into a memorandum of understanding with our state respite coalition, which I think is on the next slide we're going to talk about. So back in 2010, when we got our first grant, federal grant that was awarded to us, we formed a partnership of what we call a core team. And this includes us, the New York State Office for the Aging, the Monroe County Office for the Aging. And the reason we chose them for a partnership is because the statewide coalition NYSERC is housed at Lifespan of Greater Rochester. So they are also part of the core team. And each member of the core team, we work collaboratively in developing a work plan that defines what our roles and responsibilities are in meeting our objectives of the grant and really, just integrating and coordinating all of the work. So The next slide, I did not include a screenshot, but I encourage you to please go and check out the coalition. They have wonderful resources there. The way she has the website designed, there is a drop down that offers for professionals or a drop down that offers for caregivers. So we also direct caregivers there for resources as well. And, you know, they do a lot of education and outreach, but something that's new, we're going to get to in a moment, is they have kind of branched out and now are doing some direct service that might be of interest to you. So we can go to the next slide. So we actually, which is a little unusual because typically the way that they run their grant cycles is either a 3-year or a 5-year grant. And we've consistently been given a 3-year grant. And for whatever reason, they opened up an opportunity last year, and it could have something to do with the pandemic, but they offered the 5-year grant opportunity to all states that had a grant already, which doesn't typically happen. So believe it or not, we're running 2 grants at the same time right now, which gets us a little confused at moments, but a lot of great work happening under each. So with the 3-year grant, I just wanted to kind of show that, you know, this is really intended to provide increased number of partnerships. We have a lot of work going on where we're expanding our volunteer respite care services and doing a lot of workforce initiative with businesses. We're really trying to partner with businesses to make sure that those working caregivers are supported. Okay, you can go to the next slide, Rae. So for the volunteer component, we often provide mini grants through this. And I say we, I mean, it's done through the coalition, but in collaboration with us. And the intent here is to try to expand respite when we can use volunteers to do so. And what I'm just trying to highlight here is just kind of the success through the years. So since 2016, when they first started to provide these mini grant opportunities, all the way up until 2020, we had 21 grants that cost us $119,000. And these were through a variety of organizations, colleges, faith-based communities, some of our AAAs. You know, some of you on the call today might have interest in a future opportunity, because I do believe that we intend to do it again in the future. And then you can see the number of hours of respite care that were provided. And then our most recent round of mini grants and what we were able to offer, which was more than over the course of those number of years. But when you really break it down from looking at the cost, I mean, if you think about if that was respite care that was provided formally at a rate of say $25 an hour, that would have cost $421,450. So when you can use volunteers and are able to, and it works for the family, it's a great addition in just building, I feel like, a infrastructure where you have some options for respite care delivery. Okay, so the next slide. We have a 5-year grant right now, which I was just talking about. And with this grant, being it was so competitive, we really were like thinking, okay, we have to think big and bold. So one of the visions we've had for a long time is in New York State, we're such a large, diverse, and the geography here, it just makes it challenging for our coalition to have far enough reach. So we wanted to pilot a satellite of NYSERC with a regional caregiver wellness and respite center. So we successfully got this grant, and we did build in a year of development where we are going to be kicking off and starting this in June. I'm sorry, they open their doors July 1st. So we've been working on it for a year, and they will serve caregivers across the lifespan as well. And it's in a 6-county region. I did not include the map here, but and I don't know that I'm going to remember it off the top of my head, but it's all in the North Country with the exception of St. Lawrence. And we partnered with SUNY, the SUNY Research Foundation. And why we did that is because they already had the infrastructure built. They are a provider under the Alzheimer's Disease Initiative, and this really just is expanding the population of caregivers that are being served. So we're excited to kick that work off. We encourage you to be on the lookout. We're going to be doing some kickoff events in June of this year. That's where I got the June from, before they officially open their doors. But so they're going to be kind of like care navigators, just really helping with assessing and access assistance for all caregivers in that region. Okay, so you can move on. This is another exciting opportunity that I just wanted to bring your attention to. So something else that we built into the grant is we wanted to bring to New York State an online respite worker training. And this can be customizable, I guess you would say, in that if you are focused on a particular type of provider, so like for kinship caregivers, you know, maybe it's a consumer directed model where the caregiver wants to hire their own individual person to provide that respite care, but they want to make sure that they have some skill set in order to do so. The training can be, you know, targeted towards a particular skill set, but it gives the core competencies that we feel are needed for a respite worker. So NYSERC was on board to kind of develop something with the grant funds that we received. And while we were waiting to hear whether we were awarded this grant, an opportunity presented itself where the Wisconsin Coalition applied for some grant funding, and they wanted to pilot in partnership with 8 states, enhancing their existing respite worker online training platform. So we were super excited to see that opportunity present itself, since it was work we were going to undertake anyway. And so we applied for that collaborative and were accepted. And so we have been working with them to get the online platform ready for launch, because there are 3 modules that are state specific. And the coalition, if they have not done so already, it'll probably be next week, are launching the training and are looking for respite workers to take part in the training. There's 100 slots. And we are, of course, doing this work this year through the end of December as part of that pilot, but we intend to keep it here in New York. So the coalition's really excited about having that opportunity for respite worker training moving forward. So here also a big thing that and I know I'm running out of time, so I want to get through this because this is very important for you. We identified kinship caregivers as there being a real gap in services for respite care. So we've dedicated $100,000 to offer vouchers for respite. This went live in January. So this program is up and running. And if you are working with a caregiver that you feel could benefit from receiving a voucher so that they can access respite care, it is a caregiver directed model. So they would have to find the staff to provide the respite, but we would allow for up to $600 in a voucher for them to be able to get some respite for themselves. So more information can be found on the coalition's website, but we are really pushing and trying to market that this is available. The applications have been coming in slow, which we expected since it is still pretty early in this program launching, but just if you can help us in any way spread the word, that would be wonderful. And I encourage you to check out more information on the webpage.
Really exciting stuff, Deana.
Yeah.
If anybody has questions, feel free to get in touch with the navigator as well. We've got access to those vouchers. And we also have a lunch and learn where we did more extensive information on those vouchers back in December. So you can find out more information for that as well on the navigator's YouTube page.
And the other 2 things I just wanted to quickly touch on, caregiver resource centers have primarily, because it's in the elder law, been focused on caregivers of older adults, but there's actually some legislation that's gaining traction right now for them to expand the population of caregivers that can be served to include kinship caregivers. So we're really excited about that. You can move on, Ray. There's 17 caregiver resource centers in the state. And so I know all these slides are coming to you and I'm just looking at the clock, so you can go ahead and move on, but feel free to look at where they're located. There's a list of them there. They provide training, workshops, support groups, counseling. So it kind of gives them the ability to enhance some of the services that they offer under their National Family Caregiver Support Program. And then lastly, I think we just included some information about how we've pivoted with a lot of services, like many of you having to kind of, switch into a virtual programming. And, technology, of course, was huge in offering services that could support the technology, telephone reassurance. And I think after that, I think there's just the TCARE, which is another pilot project that we have undertaken over the last year, and we're continuing our pilot through the end of this year. But this is an assessment tool, and it's evidence-based. There's only 2 caregiver assessment tools in the nation that are evidence-based. And I will tell you, we're not piloting this protocol, but they are building a protocol, if they haven't already, because she said they were working on it a couple years ago, that was targeting kinship caregivers. But the pilot's been going great, and there's algorithms built in, and it just provides a really gives you a lot of data. It shows you really like those outcomes when you're supporting caregivers and doing the screening, assessing, and following a care plan with a very person-centered approach. So just wanted to kind of share information on what TCARE is all about. I think it's tailored care assessment and referral is what the acronym stands for. But you can go to their website and learn a little bit more about what that assessment process offers. And I think that that's it. I know we're at 12:30, so I'm sorry that was a lot of information to throw at you, but I'll stop and see if anyone has questions.
I think you did a great job. Thank you so much for that. There's always so much being pushed out by NYSOFA, a lot of exciting opportunities and resources for caregivers. So we always appreciate your partnership. I'm looking, I don't see any chat questions coming in so far. But if anybody thinks of any questions that they have, they want to get in touch with Deana, you see that we've got her contact information right here. Questions after the presentation, reach out to Deana, reach out to myself. And as always, thank you everybody for joining us today. We appreciate your lunchtime. We will be sending out this video as well as the slides in our permission to contact form early next week to everybody that registered. It'll be available also on the Kinship Navigator's website and Kinship Navigator YouTube page. So thank you, Deana, again, and thanks, Anne, for your support of the Times Union. We appreciate it. And we look forward to seeing everybody next month for our March Lunch and Learn with Prevent Child Abuse New York. Have a great day.
Thanks, Rae. You too.